Hi everyone, and welcome to your open enrollment for 2017 for Sandpiper Property Management. Thank you for joining. We have a couple of things to review for your open enrollment. Hi, and welcome to your 2017 open enrollment for Sandpiper Property Management. Today we're going to be going over your new benefits. The booklet that I'll be reviewing today is available to you as well. If you have additional questions and would like to review the material further, we'll be talking about enrollment, our advanced resolution team, the medical plans, HSA information, the new dental and vision plans, as well as life and AD&D. A quick reminder about the accident and cancer and critical illness plans, and then we'll quickly go over the required notices. One Digital is Sandpiper's partner for your benefits. A couple of things to review: how to enroll in the plan. You'll have received an email on the materials that you need to complete to enroll in the benefits for January 1, 2017. As a reminder, you can't add your legally married spouse or children up to age 26, and there are some additional details on what constitutes the child. You are able to make a change in your status throughout the year, but you do have to submit that information within 30 days of that change in status. Some of those examples for those qualifying events are going to be getting married or divorced, having a baby or adopting a child, taking a new job or losing a current job, your spouse passing away, or becoming eligible or losing Medicaid coverage. Those are all reasons that you can come in mid-year to make a change to the benefits that you're enrolled in. Otherwise, you're locked into the decisions that you make for the next year when we have open enrollment next year. You have access to One Digital's Advanced Resolution Team. This is an additional customer service resource that you can utilize outside of the insurance carriers. We work on your behalf to help make any changes throughout the year, whether it's enrollments or whether you may have an issue with any claim that you have. They're available, and the contact information is listed here. You can reach out by phone or by email, and they are available Monday through Friday from 8 to 5, and they're located in our Richmond, Virginia office. So we do have some exciting new benefits for January 1, 2017. We have a new medical plan that will be offered through United Healthcare. We have dental with Sun Life, vision insurance through IMED, life and AD&D with Sun Life, an HSA carrier with Health Equity, and an accident, cancer, and critical illness with Transamerica. Historically, you've had one medical plan available to you. It's a $5,000 high deductible health plan. That plan has an upfront $5,000 deductible if you're an individual, and then you have a $10,000 deductible if you have family coverage. All services do have to will have to be paid for in full with the United Healthcare discounts until that deductible has been met. So for example, if you go to the doctor's office for a sick visit, if you go to the emergency room, have inpatient services, that would be an overnight stay at the hospital, outpatient services, any lab work, those are all applicable to that $5,000 deductible for the individual or $10,000 for family. Once that's been met, then your medical services are then covered at 100% for the remainder of the year. For the prescription drugs, you also pay the full cost of the prescription drugs until that deductible has been met. After it's been met, then you would switch over to copays of $10 for Tier 1, $30 for Tier 2, and then $50 for Tier 3 if you're picking them up at the retail. Through mail order, you have access to do that. That's if you're taking a 90-day supply of a medication. So it might be a maintenance medication Those you can get, and it's 2.5 times the retail copay. So you get 3 months and you save half of a copay. So $25 for Tier 1, $75 for Tier 2, and then $125 for Tier 3. One thing to note is that you will see your preventive care services are covered at 100%. So that's going to be any annual physicals for children, the well baby and well child checkups, their immunizations and vaccinations, and certain cancer screenings for you, whether it's a mammogram, the prostate blood test or PSA test. Those are all covered at no charge to you throughout the year. The key thing to remember is that it is for preventive services. If you have a medical condition that you're seeing the doctor, then those services would apply to the deductible. And after that's been met, then they would be covered at 100%. Again, the deductible is $5,000 for an individual and $10,000 for a family. And then over the course of the year, the maximum out-of-pocket that you would pay, that's the worst case scenario, is $6,250 for the individual or $12,500 if you have family coverage. You'll see a new benefit being offered this year called, and it's more of a traditional copay-based plan. It is slightly more expensive. We won't be reviewing the rates today. However, you will have access to those either through distribution through your managers or if you are a new hire when you are brought on. However, the benefit, the way that it works, is that you will have a $2,500 deductible for an individual, $5,000 if you have family coverage. But with this plan, you do have certain visits where you have just a copay. So if you go to a primary care doctor, it's a $30 copay. If you go see a specialist, it will be a $60 copay. If you go to the urgent care provider, that's sometimes described as like a doc in a box. Some places it's a standalone facility not attached to the emergency room for weekend care. That's going to be a $75 copay. If you go to the emergency room, it's a $150 copay. And then if you have to go into the hospital, so you have inpatient services, that's an overnight stay, or outpatient services, or you have any lab services done, you'll pay the full cost of that visit, but you will get the discounts by having the United Healthcare plan. But after that deductible has been met, then you'll pay 30% of the remaining bill. So those services, you do have to meet the deductible, and then you'll pay the 30% coinsurance. If you have advanced diagnostic services completed, that's going to be things like MRIs, CAT scans, PET scans. You'll have a $150 copay for that service. For prescription drugs, Tier 1 is a $10 copay, Tier 2 is a $30 copay, and Tier 3 is a $50 copay. Just like we mentioned before, mail order drugs are available. If you take anything on a maintenance basis, that's every day. You can get up to a 3-month supply for 2.5 times the retail copay. So again, you're just saving half a copay. $25 for Tier 1, $75 for Tier 2, and $125 for Tier 3. And for those that are curious, Tier 1 are typically your generics, Tier 2 are the preferred brand name drugs, and then Tier 3 are the most expensive drugs that are out on the market. They're the non-preferred brand name drugs. They're brand new. They could also be the higher cost biosimilar drugs or self-administered injectables. So those are pretty costly. They can be anywhere from several $100s to several $1,000s each month. But you're capped at the $50 copay under this plan. Over the course of the year, through copays and coinsurance and meeting that deductible, the most that you're going to pay is $6,250 for the individual and $12,500 for the family coverage. As you're reviewing the benefits and you're trying to decide which plan makes the most sense for you, you're going to want to balance the cost of the plan. The $5,000 high deductible health plan is going to be less expensive than the traditional copay-based plan. However, if you do have medical conditions, if you have high-cost medications, sometimes it can make sense to consider the traditional copay-based plan. So that's why it's being offered this year. And of course, if you have questions, you can reach out to your manager who will get in touch with HR. Moving along, for the $5,000 deductible plan, there's a health savings account, or HSA, that you're eligible to open up to help save money for any medical expenses that you have over the course of the year. The HSA is your money. It's, as soon as the money goes into the account, it's always yours. You have the ability to contribute up to $3,400 for this upcoming year for an individual. And then if you have family coverage, you can put in $6,750. And if you're 55 or older, you can make a catch-up contribution of $1,000. All of the money that goes into the HSA, you can do through payroll deductions, and that is put in on a pre-tax basis, meaning you do not pay taxes on that money. And when you use the money out of the account, you do not pay taxes on that money then either. So it's a great way to save money when you are filing your taxes. It helps reduce your taxable income. The money that's in the account can be used to spend on any medical expenses that you have, whether it's visits to the doctor's office, the hospital, for lab work, or prescription drugs. It can also be used for medical, dental, or vision expenses, even if it's not covered under the medical plan. However, if you do take the money out for a non-eligible expense, you are subject to taxes and a 20% penalty if you're under age 65. After age 65, you just pay taxes but no penalty. There are some requirements to be able to open up that HSA. You cannot have any other health insurance coverage, so that high deductible health plan with the $5,000 deductible is the only health insurance plan you can be enrolled in. You can't have TRICARE or Medicare or have had VA benefits in the last 90 days. As well, you or your spouse can't contribute to a medical flexible spending account. And then you have to be enrolled in that high deductible health plan over the course of the year to contribute. The name of the vendor that will be administering these accounts is Health Equity, and they have access for you all through their customer service team 24/7. 365 days a year. They're available online as well as by phone, and additional information is available through your packets that are being distributed. New this year is a dental insurance plan that we're excited to offer through Sun Life. The way the dental insurance works, you'll see some information here. You'll have an annual maximum of $1,000. That means that's the most that the dental plan is going to pay out for services over the course of the year. You'll have preventive services covered at 100%, no charge to you when you're going in network. So you have exams, cleanings, x-rays for your children, fluoride treatments and sealants. Those are all covered at 100%, no charge to you. If you have to have additional services, you'll have to meet the annual deductible. It's $50 per person, but a family would have a maximum of $150 in annual deductible costs. For basic services, you'll see those listed type 2. Those are going to be fillings, root canals, periodontal services, extractions. You do have to wait 6 months before you're able to receive those services. After that time frame, you'll meet that $50 deductible, and then Sun Life will pay 80% of the cost, and you'll pay 20% of the cost. For major services, crowns, bridges, dentures, and inlays, and onlays, similar, you have to wait 12 months before those benefits kick in, but you'll have to meet that deductible if you haven't already met it of $50. And then it is a 50% split between you and Sun Life for the cost of the services. This is your one chance to enroll for services. You'll have immediate access starting for 1/1 for the type 1 and type 2 services, but you would have to wait 12 months for the type 3 services. So now's the time to sign up. If you're an employee today and you wait until next year to sign up, you will have additional waiting periods that you would have to meet before you can access services. You'll also see out-of-network benefits. Those, the benefits are the same, however, keep in mind that when you do go to out-of-network providers, you do have to, you are subject to balance billing. So if that dentist charges $100 for a cleaning, but Sun Life only allows $75 for that service, as an example, then they could balance bill you for the $25 difference in that bill. It's always best to try to go in-network and use the Sun Life network. However, you do have the freedom. You're just subject to balance billing if you go out of network. You'll have an enrollment form that you'll need to complete if you want to sign up for dental insurance this year. Also new this year is vision insurance. This will be offered through IMED. They have national network that has providers that are private practice facilities as well as larger national chain providers. The way that the vision plan works, you can pick this plan and any of the other plans that we've talked about today independent of each other. So you can pick the medical or the dental or the vision, all three or one or two, whatever works for you or in your family. The vision exam, you can get that once every 12 months, and it'll be a $20 copay when you're going in network. And then if you have to have lenses, you'll have a $20 copay depending on whether it's single, bifocal, trifocal, or lentacular. Those you can get a new lens every 12 months. And then your frames, you're also able to get a new frame for your glasses every 12 months. And you'll have a $130 allowance. If the cost of your frame is more than that, you'll get a 20% discount over and above the cost. And then if you wear contact lenses, you will have a $130 allowance for those. And if they're conventional, you'll get an additional 15% discount. If they're disposable daily contacts, there's no additional discount. And then if they're medically necessary, you would have no copay for those. They're paid in full. However, it is rare to have medically necessary contacts. It is for certain medical conditions. So this new benefit, it's fairly inexpensive. You can cover yourself or any family members. You do have to cover yourself in order to provide coverage for anyone else, similar to the dental plan. And it's a great benefit if you wear glasses. A new and exciting benefit that's being provided to all employees at Sandpiper Property Management is a life insurance benefit. So it is a $10,000 benefit if you were to pass away. And then if you were to pass away in an accident, there is an additional $10,000 benefit as well. But in general, everyone's eligible for that $10,000 coverage. It is important that you complete a beneficiary form and submit that. And we would remind you that if you have any life-changing events throughout the year, you can always update that beneficiary information at any point in time. So if you are newly married, newly divorced, have a new baby, those are all things that you may want to update the beneficiary information. So it is a full $10,000 benefit, and you do not have to pay for that. It is provided by your employer. A few reminders on the Transamerica benefit for those of you that have been with us in the past, or if you're new, we just wanted to highlight the plans that are available to you. The accident insurance and critical illness and cancer are all provided through Transamerica. For accident, this plan is going to provide you additional coverage or reimbursement if you're in an accident or have an injury throughout the year. It's totally separate from the other plans, so you could choose this separate from the other insurance coverages. You'll have a wellness benefit of $150 if you go for your wellness checkup over the course of the year. And then your spouse is also eligible for $150 benefit if they go for their wellness checkup. So that's a total of $300. And that generally helps pay for the cost of the accident plan. So if you have a child that plays sports, if you are historically accident prone, this can be a great plan to provide some additional benefit for certain accidents that happen throughout the year. There's also a critical illness plan. If you are diagnosed with a heart attack, stroke, paralysis, burns, end-stage renal failure, or a surgery that includes a heart transplant, a coronary bypass, angioplasty, or major organ transplant, then there is a lump sum benefit that you can elect that will pay out if one of those conditions happens to you. And it is, again, separate from your other benefit coverage, and this also has a wellness benefit of $150 for each covered person if they are going for a health screening test. And those test specifics are listed in the Transamerica benefit summaries. There's also a cancer plan that will pay benefits if you have treatments or incur expenses due to cancer. So if you have any hospitalization, surgery, imaging, travel, things like that, chemotherapy, there is a benefit for each thing that you may have that is in relation to cancer treatment. There's also a wellness benefit if you go for your annual cancer screening test each year of $150. There are more specific details about the plans in the Transamerica information. This is just a high-level overview that we wanted to provide. And again, not everyone will be signing up for all the coverages that are available, but it was Sandpiper Property Management's goal to really offer a full array of benefits this year for employees to be able to consider what really is going to be the best for not only you, but also the family members that you cover. There are some additional required notices that you'll see that are posted. There is the Newborn Mothers and Health Protection Act, Women's Health and Cancer Rights Act, as well as the Children's Health Insurance Program notice that is available to you in the full benefit summary. And you will need to complete enrollment forms. I'm going to go back real quick just to highlight the plans. You will need to complete enrollment forms if you are making a change for the medical plans. If you're staying in the same plan that you're in today, you would not need to fill out a form. If you are interested in opening up an HSA, there is enrollment information that you would need to complete for that. The same goes for dental insurance or vision insurance. You would need to complete enrollment forms since those are new benefits and have those submitted. The due date is December 27th. For life insurance, this new benefit, you only need to complete a beneficiary form and make sure that's turned in and on file. And then for the accident, cancer, and critical illness benefits, if you decide you want to enroll for the first time this year, you would need to complete a form. You may have to answer additional medical questions for the cancer and critical illness policies and submit those and wait for approval. If you have any questions, feel free to reach out to your direct manager who will get in touch with HR, or if you have additional questions throughout the year, remember that, again, you have access to the Advanced Resolution team through One Digital. Thanks so much, and I hope you have a great day.